YouTube. So if you guys can please like, invite, and share on there, would be greatly appreciated. So this is Medical Monday. My name is Dr. Grace Patterson. I'm managing owner of Bethesda Holistic Center, and um, everything new, which is integrative restoration, anti-aging, concierge or designer medicine, however you want to call it. We're in Metro Detroit area, Southfield, Michigan at 21411 Civic Center Drive, Suite 102. And our telephone number is 248 356 1111. That is 248 356 1111. And our website is www.bw-center.com. We should have a free download tonight. Please go over there and get that. It has a plethora of information. It's www.bw-center.com/mm for Medical Monday. Please go ahead and get that information. You'll be glad that you did, because we want to reward you in your time and effort. Hey, Reese, thank you for joining on. Please like, invite, and share. Hey, Ebony, please like, invite, and share, please. We're talking about hair restoration on tonight, plasma replacement therapy. And we're going to be talking about that tonight. And we'll be going, talking about it in great detail because we do a lot of natural modalities here at Bethesda Holistic Center, where we treat the whole man, spirit, soul, and body. So this month, we're going to have some great topics on tonight. And this month, really, and I want you guys to inbox, well, we don't inbox anymore, message me or make comments in the comment section on any subject you guys want to talk about. And we're going to try to incorporate that. We already got April already set, but we can start talking about May and June or whatever. So please like, invite, and share. We're going to, for you guys to get on tonight. It is 8:06. I'm going to give you guys a few more minutes to pile on here. I'm Dr. Grace Patterson, managing owner of Bethesda Holistic Center. Hey, Sister Doris. She a faithful medical Mondayer. Please like, invite, and share. I see some new people on here. Ebony, I see Reese, someone new. I thank you guys for and joining on. Please like, invite, and share. We're going to be talking about hair restoration. We're going to be talking about how to restore the hair that has been lost. How about that? I'm going to share with you guys a little bit. As you guys, you can see, I'm natural. Um, and it was I love, I ain't gonna lie, I love weaves. I mean, they're so convenient. And as some of you guys know, that this year have been promoted and elevated, and one of the things the Holy Spirit spoke to me was um, not everything new and nothing fake. I was like, okay. So I've been a while since I've had a weave, but okay, I was like, okay, nothing fake, everything new. So and for a long time, I have been contemplating whether or not to go natural or not. This is my own personal testimony. Hey, Terry, thank you for joining on. Please like, invite, and share. But how is it that the way that God created you? I remember seeing some comments about natural hair not being professional, not being a polished look, not being whatever, how people wanted to describe it. But my question is, how God created me, or my natural, what God gave me, is not professional or not polished. It is what it is, but that's just for me. I mean, that's just what's going on with me right now. Hey, Phyllis, thank you for joining. Hey, Crystal. And then I know some people may have hair issues. Hey, Phyllis, may have hair issues where they can't wear their own natural hair, be it from chemotherapy, um, hormonal problems, diabetes, chemical damage, all those things, alopecia areata, which means they really don't know what it is, but the hair is falling out. I have my own theories on that, but we're going to talk about that in a little bit as we go into our session on tonight. So let's talk about platelet replacement therapy for hair. Platelet replacement therapy can be used for a whole myriad of situations. But tonight we're going to specifically talk about hair because for men and women, your hair is your crown and glory. Yes, that's the first thing people see when they see you. They see your eyes, see your hair, see everything. So what is platelet replacement therapy? It is plasma drawn from the patient or the client who comes in, and then it's separated from the other blood cell, from the hemoglobin or the red blood cells, and it's by a process called centrifugation. There's this little machine. You guys have gone to the doctor's office. You probably heard it spinning, and it's separating. Hey, Crystal, thank you for joining. Please like, invite, and share. And it's separating the plasma from the red blood cells. So what it does, the increase the concentration of platelets to combine with the remaining blood, and the concentration of platelets can be 5 to 10 times greater or richer than usual. Because you got to remember, with the red blood cells, you have platelets, you have all these other type of blood cells, and then you want to separate those out. And what's the premise and the theory on how it works? Platelets are close to what we call stem cells, and you guys know there's a lot of controversy out there about stem cell therapy, and things of that nature. Stem cell therapy is, in certain areas of the world, is legal, and certain parts of the world is not. In the United States, there's a lot of laws on the books that's trying to get stem cell therapy um, regulated and possibly legalized and be able to use. So, what is a stem cell? Stem cells come from embryonic tissue. We all have started out with stem cells as embryos, and the embryonic stage is where it's what we call a, in my terminology, this is Dr. Grace terminology, a naked cell, and it is waiting for instructions to become something. So, the stem cell, when it is very amazing. God, you're fearfully and wonderfully made. God is created, creative and a masterful, and masterpiece is human beings. Believe it or not, we were never created to die. How about that? We were really created to live forever until the fall of Adam. But that's a whole nother story. So let me get back on track. So a stem cell is what we call a naked cell. It's my own terminology. A naked cell that's waiting for instructions to become something. So a platelet is close to a stem cell. So when it gets around other cells, like hair follicle cells or any other cell, that cell communicates to that naked cell, hey, you're here, so you need to make some hair, because all of us here is making hair. That's the most simplest way that I can describe how it works. So in certain situations, they want stem cell therapy. Hey Tina, thank you for joining on. Please like, invite, and share. Stem cell therapy for regeneration of nerves, um, a whole myriad of things. So if it's injected in the spine, that is not working like it's supposed to, those cells will tell that stem cell, hey, you need to make some nervous cells, or wherever it goes, those cells communicate with that naked cell to become part of the area where it's injected to. Now, a lot of people say they don't like needles. Um, I hear that all the time, Dr. Grace. I'm scared of needles. I don't. I even hear. Listen to this one, guys. I even hear from people who have a myriad of tattoos and piercings that they don't like needles. I don't get it, but that's a whole other story. So they were like, it's different. Okay, it's different. I don't know, because I don't have a tattoo, so I don't get it. I don't know. But a needle is a needle is a needle in my book. So, but even with IM injections and stuff like that, I am kind of good at that. Sometimes I give people shots and I'm waiting for the shot. I'm like, I'm done. But anyway, the scalp is a very sensitive area. You have tons of nerve ending, blood supply, and all of that kind of thing. And with the platelet replacement therapy, we take the blood out of your arm. And I used to be a phlebotomist in my past employment. I was a very good at it. Even as a medical student in medical school, I was when they couldn't get it, they would come and get Dr. Grace. But anyway, and we get the blood out of your arm. Like we said, we put it in a centrifuge, separate it, and then we separate it. Use a pipette or in some cases, everybody has their own method or methodology, but I do mine that way. I actually take the time to pipette it out and actually put it in syringes. I also use numbing medication to the scalp. I can't guarantee that you won't feel it at all, but I can numb it up some, so it won't be as bad. One of the areas that I normally use is around the edges. A lot of women have what we call attraction alopecia. Hey, Maria, due to braids or attraction from individual braids or weaves or whatever. And then there's what I call friction alopecia from women who's had worn weaves for such a long time that the extension has rubbed on the edges for so long that it has basically rubbed that hair away. There's also hair loss or hair that's being due to hormonal problems. It could be a person that has that has hormonal changes. One of the number one chemical hormone problems that I've seen in hair loss that I have experienced myself personally. I'm going to post some pictures on Medical Monday after today. So after today, I want you to guys see my before and after pictures, which is cortisol. Stress hormones can cause hair loss. Another thing that can cause hair loss is certain diseases, autoimmune diseases, where your body attacks itself. So um, lupus, what they call systemic lupus erythematosus. I'm saying that right. SLE or lupus. Okay, and that can cause hair loss as well. Another thing that can cause hair loss is medications. I see this a lot, and I have a lot of seniors who are concerned about the hair that they're losing due to different type of medications. The primary three culprits that I can name off the top of my head that I have experience with. Hey, Susan. Hey, Xander. Thank you for joining on. Please like, invite, and share. Is antihypertensive medications or blood pressure medications, a diabetic medication, and seizure medications are the top three that I know of can cause hair loss. Number four, hormones. Depo-provera. Yes, one of the side effects, if you read the listing, is hair loss. So a lot of women that can be on certain type of pregnancy. Hey, Kathy, thank you for joining on. And that can cause hair loss or hair thinning. Are those top four? So antihypertensives, diabetic medication, seizure medication, and certain type of hormones can cause hair thinning and hair loss. And then we talked about the different type of hair damage, things that are put on the hair, any type of chemical. If it's not done properly and it's not done correctly, or even you need to have your chemicals applied by a licensed cosmetologist, not by Pookie and Ray Ray and them in their basement. Okay, and you just heard from somebody else that they do hair real good or whatever, and you don't know what's going on. So you got to make sure that they're licensed cosmetologists, and then they also need to do what they call a patch test, especially for those of us that's maturing and getting a little more gray and want to use color to cover the whiteness or the grayness of your hair. You should do a patch test, especially if you have skin sensitivities and things of that nature. Also, things that can cause hair loss is diet. Well, I hate that word, or food choices, poor food choices, right? If you're not eating right, it can cause problems with your hair because your hair is an extension of your skin. So the biggest organ of the body is your skin. And as you know, you have follicles throughout your whole body. So one of the things that you need to do is eat properly. If you don't eat properly, then you're going to have hair issues. One of the other things, because we believe at Bethesda Holistic Center, healthy hair from the inside out. So you got to make sure that you hydrate right. And I talk about hydration in almost every show. So you got to make sure you drink the right amount of water. Now there's three types of water, or water is water, but there is different types of water, and you guys know that if you listen if you're on Medical Monday, regular. Hey, Regina. Hey, Felicia. Hey, Judy. Hey, Jennifer. Hey, Kathy Gaither. We grew up together. We were neighbors. My mom and her mom are still neighbors for over 47 years. Yes, thank you for joining on. And this is not only for people that are having hair issues. If you want your hair to be a little bit longer or thicker or whatever the case may be, this is a treatment for you. So let me get back to what I was saying in regards to healthy hair from the inside out. Water hydration is very, very key. There's tap water, there's alkaline water, there's distilled water. You have water that are enhanced with electric lights. Hey Chantel, thank you for joining on. Please like, invite, and share. Hey Regina, please like, invite, and share. So you got to make sure that you hydrate. And of course, the right amount of hydration, for those of you who are under the sound of my voice, is your weight divided by 2.2, and that's the amount of ounces, right? And the amount of ounces, you could, a water bottle size is 16.9. You take that number divided by 16.9, that tell you how many bottles that you need to be drinking a day. Unfortunately, the more you weigh, the more you need to drink. Another thing too, if any of you are under the sound of my voice or under any type of water restrictions whatsoever, hey, Brother Green, thank you for joining on. Hey, Lisa Nanny, thank you for joining on. Please like, invite, and share. Anyone under the sound of my voice, any water restrictions, you need to drink that amount that they recommend that you drink for that day. If you don't, you're putting your body in a dehydration state. So your body can't function and work like it should. So let alone your body, your hair to your body is not of importance. Your major organs are. So whatever you're not giving your body will shut down certain areas to make sure that the core of your body is being taken care of. So let's say, for instance, you're a person that's dehydrated. What is that? A person not drinking enough water. They're not. They have not glycerine. You see how my eyes are glycerine in there. The mouth is pasty, not pasty, and they have the white stuff in the corner of their mouth. Eyes may be a little sunken. There's this test that you call tinting. You pinch your skin and their skin still stays up. It's a sign of dehydration, especially in children. If they're crying, not making tears, not the same amount of wet diapers, or for adults, you're not going to the bathroom as much as you use. It's all signs of dehydration. Headache, nauseous, not feeling good. It's all signs of dehydration. So if you're dehydrated, your body is like, I need to take care of the core organs. My core. What is your core? Your heart, your lungs, your stomach, your gut, your liver, your core needs to be taken care of. Everything peripheral is secondary. So your body will shut down, or should I say decrease the nutrients to those areas, because the body now has to function in the core. So you got to make sure that you do everything that is necessary to maintain that hydration status. So again, there are several, I named several reasons why people could have thinning hair, things that can happen to the hair coming out. And I talked about medication. I talked about certain disease states. One of the things that I forgot is thyroid disease. This thyroid disease can cause hair thinning, low thyroid. So low signs and symptoms of low thyroid is people losing half of their eyebrows, thinning around the edges, even in the top of the crown of the head. They've cold all the time, hard for them to lose weight, depression. All of those are signs of what we call hypothyroidism or low acting thyroid. So all the things that I'm talking about, even platelet replacement therapy, we have to address the issue why the hair is being lost or being lost. So if it is a thyroid issue, you got to address the thyroid. If it's a traction situation from braids, weaves, and all that other kind of stuff, that needs to be addressed. If it's chemotherapy, radiation, those type of things, you need to understand what's going on in the inside of your body. Is there any deficiencies or anything like that? Is the hair follicle still functioning? Those are the type of things but that's a holistic synergy discuss. Hey, Cassandra, thank you for joining on. Hey, Susan Oliver, thank you for joining on. Please like, invite, and share. So those are the things that you guys have to be mindful of, is that You can't be putting stuff on top of your head to get it to grow if it's something that's going on in the body that has to be addressed too. So that's one of the things that we do at Bethesda Holistic Center. We offer vitamin testing. We test all the vitamins. I'm gonna tell you a true story. I had this one young lady, her hair would grow, beautiful head of hair, and then when it get to a certain lip, it would just start shedding, and it would just come out to find out she had what we call a fructose sensitivity. Fructose is in everything, and part of our testing was able to tell that. So she was hey Cassandra, one of the things that she liked was ice cream and Verner's pop. So she had to cut that out, but you know, fructose is mostly in everything. But she cut down her fructose intake, so her hair situation abated some. But we did other things to help regulate or to stimulate hair growth. So, or promote healthy hair from the inside out. How about that? Hair restoration. Okay. So those are the type of things that we need to address and think about. So, like again, lupus or any what we call autoimmune disease where the body attacks itself, or a chronic inflammation state. Hey Renita, hey Marnisha, thank you for joining on. Please like, invite, and share. Chronic and or allergies. Let's talk about those two right quick. Chronic inflammation, where the body is always in an inflamed state, and what causes chronic inflammation. Chronic inflammation can be from the foods that we choose to eat, or not choose to eat. How about that? So you things that help with chronic inflammation is definitely more fruits and vegetables, more fruit. Alkaline water in between meals would help to bring the inflammation down. Things that causes inflammation is a diet high in sugar, high in fast food, and things of that nature. And this is one of the things that I want to talk about chronic inflammation too, is a yeast problem. Our society is endowed or indoctrinated, however you want to call it, or infused with yeast. And where is that yeast coming from? Um, let's talk about it for a minute. I'm gonna be talking about this. Why you should consider nothing white. That's one of my topics. Matter of fact, that's gonna be next week. I'm putting that plug in right now. I'm gonna be talking about that. One of the things we want to talk about is yeast. It's kind of like a spiritual thing and natural thing. We just came off Passover resurrection, and for the resurrection, and one of the things that was one of the feasts is unleavened bread. Okay, so they unleavened bread means no yeast. And one of the things that biblically he tells them during Passover is to get leaven out of your life. Hey, Deshaun, thank you for please like, invite, and share. And from the spiritual connotation, leaven means sin. But believe it or not, those instructions was a form of a detox physically. And so, what is yeast? If you look up yeast, yeast is a fungus. Yes, yeast is what we put in bread to make it rise. A little leaven spoils the whole lump, or a little yeast makes the yeast or the flour or the dough rise. So when we eat bread, we're eating a fungus. I'm going to see lie on that for a minute. When we eat bread, we are eating a fungus. Yes, yeast is a fungus. And what it does, it is a budding yeast. It buds, and that's what causes the dough to rise. So when he gave us instructions, biblically, from a spiritual perspective, leaven gets sent out of your life. It was a form of detox for the body also, to get the yeast out, to eat unleavened bread. Don't make bread with yeast in it, because your body needs a rest from the yeast that you're putting in your body. So if we're constantly eating bread all the time, yeast builds up in the body, and yeast causes a whole myriad of things. You have people that have eczema. They'll break out with eczema. They're itching. It will cause hair to fall out because it causes inflammation. Person itch. Women can have vaginal yeast problems. People can have yeast in their mouth or on their tongue. It could be in the folds of your skin, under the breast, under the arms, in skin folds. When you have yeast problems can also cause headaches, can cause a person to feel tired and lethargic. It can cause a person to feel nauseous and to have headaches because you're not supposed to be a living petri dish. You're not supposed to be carrying yeast. Okay, so that can cause chronic inflammation and cause a whole myriad of problems. Okay, so how does platelet replacement therapy pay in all of this? So we talked about all the causes of things that can cause hair to thin and all that other kind of stuff. So I talked about platelet replacement therapy as an option for hair loss because it has a number of scientifically basic articles showing the efficacy, increasing hair count, hair thickness, and the growth phase of the hair cycle. It was featured on ABC morning on today's you look at our Facebook post. It's called a feature on ABC's News in the Morning. Paula Tupman did a segment on it because she had a experience with hair thinning or hair thinning of her own due to a chemical process. Risk involved. The only thing people have a problem with is that it's a needle involved, and a lot of people are scared of needles and all that other kind of stuff. So if you have a needle phobia, this may not be for you. But it's a natural process. What makes it natural is because we are taking platelet cells from you and putting it in the area again, like I said, almost naked cells that are waiting for instructions on what to become. So it can stimulate and promote hair growth. Nothing is 100% guaranteed. Everyone's different. Everybody's body is different. The only risk involved again is bruising may occur. Minimal downtime. I did one last about 2 weeks ago. I did one lady, and she came in. She saw, matter of fact, she saw the show from Paula Tupman. And if you go to WDIV web page or wherever it is, they list me as one of the doctors on there. And she called and asked us about it, and she came in right away. Um, um, for a whole myriad of reasons. She was an African American woman, and she said she wanted to have an African American doctor. So thank God for that. But again, please do your research. And if this is something that you're interested in doing, we can provide that service. Again, the traction alopecia around the edges is mostly oftentimes what we do for that. What I tell people that have undergone chemo or any type of radiation, I highly recommend that you do blood testing to find out what deficiencies that are going on in the body, because chemo and radiation does not discriminate. It also go after the cancerous cells, but also healthy cells as well. So we need to make sure that that there that if there's any deficiencies, we need to address those. So if that's something you're interested in, you can contact me at 248-356-1111. Please go download the information at www.bw-center.com/MM for Medical Monday. Hey, Carrie, thank you for joining on. Please like, invite, and share. So let's talk about the men for a minute. Okay, that experience hair loss. Most men that experience hair loss, most of the time I hear you can't fight genes when it comes to men. But the God I know can even change genes. How about that? But anyway, you can't change genes. And they say that men that have what they call male pattern baldness comes from a gene from their mother. So what is the culprit of that is what we call DHT. Dihydrotestosterone is what attacks the hair follicle and causes a man to lose hair. So, but there is a biochemical pathway of enzymes that creates DHT. And people got to also recognize and realize too that we're living in a society where our food is indoctrinated with antibiotics and hormones. So let's talk about this right quick. I'm gonna go around the corner, up the street, and back again. So take this journey with me for a minute. Our food is indoctrinated or what I should say, injected with all this stuff. So let's talk about antibiotics for a minute. They especially meat products. They put antibiotics in meat products because most of the animals are living in coarse, close quarters. Some of the quarters are not very clean, so they get infections. So they like to inject the animals with antibiotics to keep the infection level down. So men, this is to the women, but you can hear this too. Sometimes when a woman is given antibiotics, right? Sometimes she can develop a yeast infection. So oftentimes when I do prescribe antibiotics, I ask my ladies, do you need an antifungal because of the antibiotic? Because the antibiotic strips away the good, strips away the good bacteria that keeps those the yeast or the fungus down and keep it from overgrowing. So if you're injecting these antibiotics into animals and then they slaughter them and then we eat them, we're eating those antibiotics. And when we eat those antibiotics, then we are also getting rid of some of those good bacteria that we have, that or good chemicals or bacteria. Hey, Deborah, thank you for joining. That keeps the yeast level down. The yeast level comes up. Okay, remember I'm going somewhere with this, so keep following me with this. So that's the yeast. That's the yeast problem. Then if we're injecting the animals with hormones, right, and then be it steroids and hormones, and then we ingest those, and then they're in our system, then we have our own biochemical pathway, both men and women, where we have all these hormones. I actually did a hormonal test on a gentleman, and his estrogen levels were really high. And I do believe that is because of ingestion of meat. He was a meat eater. But anyway, he was having these issues with his hormones. So, what happens when your estrogen level is high, your body is like, for men, I need to make more testosterone. So, a DHT is a precursor to making actual testosterone. So if you're eating all this meat that has been injected with hormones, most of it is estrogen. And we talked about that in chickens, and some chickens are injected with estrogen, and most animals are injected with estrogen, which we get from horse pee. Mm-hmm. So the man's body is like, look, I got too much estrogen, so I need to make more testosterone. So that precursor DHT is being made, and then it's in the body, and then it's like men have hair loss. So we here at Bethesda Holistic Center not only treat the scalp for where the problem is happening, be it hair loss or whatever the case may be, we're finding out what's going on in the body to address that. And you guys know, most every show I talk about this analogy about being a boat with a boat, like being a boat with a hole in it. Okay, so what you need to do is, putting stuff on the scalp, injecting the scalp, putting what they call snake oil on the scalp. By the way, I do have some good oil that's good for your hair and your edges anyway, and I make it myself. But anyway, and you're in this boat with this water coming in, and you got this pot pouring out the water, and the pot is anything that you're doing topically. The hole is what's going on inside the body that's causing the hair loss in the first place. So we may get the hair to grow, but then it may come out again because you never addressed what was going on in the body in the first place. So that's what makes our hair restoration different than anyone that is out there. Now, don't get me wrong. If it's a situation where it was done from the outside, meaning chemical or anything like that, I get that. So traction, weaves, be it traction or friction. We talked about traction and friction. So, hey, cousin Linda, thank you for joining on. Please like, invite, and share. So we get that. So putting something on topically may help those situations, but if it's coming from the inside, it definitely needs to be addressed. So at Bethesda Holistic Center, we come up with a plan that's tailor-made for you. So that is why we call it hair restoration, tailor-made specifically for you. Now, platelet replacement therapy could be an option for you. Um, oh, let's talk about this too. We want to talk about heat. I talked about chemical, I talked about traction, and I talked about friction. But one of the things I forgot to mention was heat. Blow drying, blow drying. You got to make sure that you're a stylist. Hi. My cousin, I appreciate you joining on. Please like, invite, and share. If you want to have a personal consultation with me, it's been posted right there. You can click on, you can have 45 minutes undivided attention with me where we can come up with a plan to get your hair, your crown glory where you want it to be for men and women, okay? Um, uh, why are we losing hair? We talked about that. Alopecia, autoimmune disease, attack the hair follicles. We talk about physical and emotional stress, deficiency, or too much vitamin A. Too much vitamin A. You can, okay, remember there's vitamins that can be toxic to the body. A lot of people think natural things mean that nothing is harmful. That can be most far from the truth as anything else. You got to remember, before we had pharmaceuticals, we had natural everything. So anything that you put in your body, if it's not water soluble means that you eat it and you pee it out. So those, then you have fat soluble vitamins, which is A, D, E, and K. A, D, E, and K, fat soluble vitamins can be stored in the body and they can be toxic to the body. So vitamin A, vitamin D, vitamin E, vitamin K can be toxic. So you need to make sure that you are taking them properly too. Um, Fat soluble vitamins, and one reason why I'm talking about vitamin A and E, yeah, vitamin A and E now are good for skin and hair. They are fat soluble vitamins, so they need to be taken with a good oil. So, what are those good oils? You need to call me and find out so I can tell you. But anyway, they need to be taken appropriately and at the right time, and those levels need to be monitored. Okay, so hormonal issues. Let's talk about anemia. I didn't talk about that. Anemia can cause hair problems and hair loss. Why? You have a certain amount of blood cells that you should have in your body. So when you take a deep breath, when you take air goes into the lungs and you have your heart connected to your lungs, so the deoxygenated blood, which means blood without oxygen, when you take a deep breath, oxygen go in, that air goes to those blood cells and it picks up oxygen. And then it takes it to the body, out, to away from the body through your arteries, throughout the tissues, throughout the whole body, including your scalp and your hair, and deposit oxygen so your hair can grow or can be healthy or whatever the case may be. So a person that is anemic, they have less cells to pick up that oxygen to take it out to the tissue. Okay. So that can cause hair loss. Medication, I said that. Let's talk about maturing and maturing those years. Every time you go around the sun, okay, you definitely maturing. Okay. The natural maturing process can cause the hair to thin out and things of that nature. So we have anti-aging products that can help with that anti-aging process. We can't guarantee that it prevents, diagnose, or treat, but I can tell you it will rejuvenate and replenish those cells in those bodies. We talked about overstyling. We talked about heat. We talked about chemical overprocessing. I can't even remember the last time I had a relaxer. I can't remember when. Things of that nature. I also want to say this too. There's some literature out there. This is a little nugget, a little side from what we're talking about now. That perms and stuff like that has been associated um, with fibroid tumors in the uterus. So you guys that are the sound of my voice that have still doing perms is something that you might want to look into. You got to remember that that is sodium hydroxide. Even if they talk about no lie, let's talk about that for a minute. No lie is lying. How about that? So let me tell you this: a no lie perm. The reason why they could say it's a no lie perm, because in the box before they mix it is not lie. So they could say it's no lie. They're not lying at that point. But as soon as you pour that chemical into that cream and stir it up, it turns into lye. Okay, it turns into a form of sodium hydroxide, which is a form of a lye. So at that point, while it's in a box, they can put on there, no lie. They're not lying at that point. But anyway, that's a whole other story. So you still got to be careful with that kind of thing, okay? Hydration, we talked about that. Drinking water and hair loss. Something that is often overlooked is the effect of water and hydration. One of the things I did a show with a phenomenal hairstylist that I know and that's dear to my heart. Hey, Lenora, thank you for joining on. Was talking about steam treatments, um, which opens up the shaft of the hair to allow moisture and whatever product that you put in there to get in there. And then after you do the steam treatment, you put cold water or expose it to cold air so it can clamp down and keep the moisture. For those of you under the sound of my voice that are natural hair wearers like myself, steam treatment is very, very important. For those of you stylists that are out there, if you want to know more about that, you can set up a consultation with me and I can tell you how you can go about putting that process and adding it to your salon as a service, an additional service to your clients, which would allow you to generate more revenue and also to help your clients' hair from not being so dry looking or drying. One of the things that I do also, because I do go to the gym, I did that today. They have dry and a steam sauna. So what I do is before I go in, I put my product on my hair and I go steam for a few minutes, and then I leave from the wet steam to go to the dry steam before I go out. But anyway, that not only helps with my hair, but it helps with my skin and everything else. Because they have eucalyptus and all that other kind of stuff in there too. That one didn't cost you nothing. So one of the things I wanted to touch again, the things that Bethesda Holistic Center we provide for hair restoration. Um, okay, guys, I'm sorry about that. What happened here? Sorry for the broadcast interruption, something popped up. Is vitamin testing, hormonal testing, and platelet replacement therapy. Please, platelet rich therapy, where most doctors charge anywhere from $400 to $1,200 per session. We only charge $350 per session. We do recommend about 5 sessions. You can search the internet. What we're doing is we're not trying to break the bank. We're trying to provide a service that is cost effective for you and for anyone else that you know might need the service. Now, let's be honest about this. Whatever got your hair in the situation that it is in, you paid for it. Let me just say that again. Whatever got your hair in the situation that it's in right now, you paid for it. Be it if it's a chemical damage process or whatever, you had to buy the product or go somewhere for somebody to do it, or whatever the case may be. If you're choosing to eat the wrong products or the wrong foods, you're buying that food to eat it. Let's just be honest about that. So all the disease processes that we talked about, most oftentimes it was a choice that a person made. Now, don't get me wrong, there's certain situations that happen to a person that just happened to them. I'm not talking to you, so don't take offense. It's just some things that just happen naturally. I'm not talking about that, but I'm talking about deliberate decisions that people make in regards to their health. They paid for it financially. Let's just be honest about that. So we offer also a product that's called Cytoactive. It's support overall health at the cellular level. And it has CoQ10, vitamin D3, and we talked about those. And so could you please invest in yourself? Think about it. I just said, if something has happened to you in regards to your health choices and decisions that you make, one of the things that I didn't mention, but I'm going to talk about it right now, is smoking. Oh, Lord. Smoking, $7.50 a pack, and a person smoke a pack a day, that's almost $2,700 a year. So a person doesn't have a problem with spending $2,700 a year to get some type of cancer, have poor circulation, and poor circulation affects the hair. So if you're a smoker under the sound of my voice, you spend $2,700 a year. That's almost, let's say, $50 a month time for it. That's almost $250 a month or so. So you can take that same money and come to us and get a session done for your hair. You just put that money in a jar. When I break that down to some of my patients who are smokers, I say just put the money in a jar, and at the end of the year, go on a vacation or something, if the case may be. But hopefully, you will make the right choice in investing in you. You only get one you, and I've said this plenty of time. Most oftentimes, we invest our money in more on things that are more material instead of our health. I had this one person that told me that was recent. I was like, some of the things we were talking about there, but they were on the inside out. We'll pay tons and tons of money on fast food and other things of nature, but you are worth it. You are worth being healthy, okay? Um, so, is there any questions or comments out there? If you have any questions or anything, please. Hey, Renita, thank you for joining on. We appreciate you joining on. Please like, invite, and share. So, please go to www.bw-center.com. That's our website. The download today is www.bw-center.com/MM for Medical Monday. Our telephone number is 248-356-1111. That's 248-356-1111. If you want to email us, I haven't given our email address. How about that email? info@bw-center.com. That's info, info at bw-center.com. Also on the if you have any questions, please. Hey, Sunny B, thank you for joining on. If you have any questions, please put it in the comment section. We have a few minutes left. I know we covered a lot of stuff tonight. Hopefully I answered your questions. If you have any other questions or any comments, let's talk about, at this point, I don't see anything right now. Let me tell you also what platelet replacement therapy is also used for and is good for. We talked about hair restoration tonight, microneedling or collagen treatment for the skin. It also rejuvenates because, again, remember, is a platelet cell is the closest that you can get to a stem cell, which is a naked cell. And once you put that into your skin says, hey, we need collagen. So it tells that cell to help promote and rejuvenate collagen. It's good for collagen building and for stretch marks. For osteoarthritis of the knee, shoulder, hip, spine, and my pain management pain-free center. We also offer that also for rotator cuff tears, for chronic plantar fasciitis. That means people that have that banded tissue on the bottom of their feet that hurts like crazy. Instead of injecting those areas with steroids, we can give you your platelets back to help restore that area. Pelvic pain and instability, yes. Back and neck injuries, tennis elbow, ankle sprains, tendonitis, and ligament strains. So platelet replacement therapy can be used for a myriad of things, not only for hair restoration and things of that nature. So I appreciate you guys coming on. Is there any questions or comments? Again, next week we'll be having another topic. The topic is going to be we're going to be talking about as why to consider nothing white, and as far as your food choices and things that you eat. I'm going to go into that in great detail. I talked about it a little bit tonight about bread and white and yeast being a fungus. Yes, we talked about that a little bit tonight, but next week we're going to go into that in greater detail. It is 8:53. We have 7 more minutes left. Is there any questions or comments that you guys would like to talk about, or any questions? Go to www.bw-center.com/MM for Medical Monday. Please get that free download. Guess what? We really work on our downloads every week, and it's free to use. It costs you nothing. FREE. We want to give you something because you're taking time out of your busy schedule to join us on the show. So we want you to have something that you can go back to refer to and read. Hi, Dr. Grace. I missed this. I may be asking the question I already answered. Is there anything that you can be done for growing your eyebrows? Oh, yes. You could use platelet replacement therapy also in that area, in the eyebrow area too, because there's hair follicles there. If someone has lost eyebrows from you also probably want to get your thyroid checked because losing hair and eyebrows is a classic sign and symptom is eyebrow loss. So yes, you can use the platelet replacement therapy in the eyebrow area too. You sure can. We'll just numb it up real good with some numbing cream that we use, and or we numb it with the needle. The needle kind of works a little bit faster and is more penetrating, so it lasts a little bit longer. But we can do that. Yes, we can. I really appreciate the information that you provided. Oh, thank you. Hopefully, you've gone to www.bw-center.com/mm and downloaded it. Hey, Janice, we're almost done here. We're did hair restoration and platelet replacement there. Beard too. Yes, anywhere there's hair follicles. Some men have patches in their beard. Believe it or not, patches can be due to alopecia. It also can be fungal. Again, remember, we can stimulate the hair growth, but we need to find out why the hair is missing in the first place. So we don't want to treat it and get the hair to come back in, and the underlying condition has not been addressed, because then it's going to be a vicious cycle. Hair grow, hair out, hair grow, hair out. We need to find out why the hair is missing in the first place. So yes, sir, we can do beard area as well. Yes, we can. Yes, we can. If that's something, you know how those men have those long beards. Yes, we can. We could do that as well there as well. Yes, yes, we can. Um, any other questions? It's 8:55. Again, one of the things, I think I covered everything. Let me go back and make sure that I covered everything. We talked about what platelet replacement therapy is. We talked about the downside of it. We told you to go how you can get in touch with us. We talk. Oh, this is what I get sometimes too. Biotin also is a good supplement for promote healthy hair growth. We also give biotin IM injections. A lot of people ask me, well, it'll promote hair growth everywhere. Okay, first of all, women, those of you under the sound of my voice, you do hygiene maintenance anyway. We get our brows waxed. Some women get their lips waxed. They get under their arms, their legs, and other areas. They take care of the hair. So if the primary objective is to get the hair to grow and you get hair elsewhere as a broad product, just take care of it. It's no big deal. But one of the things about the platelet replacement therapy, outside of the biotin, is that platelet replacement therapy is regional. It goes into the actually where the hair, where the follicles are. Biotin IM injections. Remember this: when you take biotin, you have to take it orally. It goes into the stomach. It's broke down in the stomach. It goes through the GI tract. The GI tract goes into the bloodstream, and then it goes through the bloodstream, and then it has to go to that follicle. So once it goes to that follicle, we don't know how much, even though it has a milligram dosage on the bottle, we don't know how much biotin you're really getting to that follicle. When we inject it IM, most oftentimes we give it into the hip. You have a slow, sustained release directly into the bloodstream that hits that follicle directly. So then you get hair growth. I missed some of the fur on my face. Oh, well, we can try it. Why don't you call Dion 248-356-1111 and try it. And then you could give your testimony. It'd be a testimonial on our show, before and after pics, so people can see how well it works. Okay, guys, it is 8:58. We have 2 more minutes. Again, remember, we have to find out hair restoration. We want a permanent, lasting results. Even those of you that's under the sound of my voice that had hair transplants, and wherever you've gone and they haven't addressed the internal cause, there is a high probability that their hair is going to come out again. So you need to make sure you find out what's going on. Okay, it's very important that you do that. It's the truth. And a lot of people don't want to tell you that. but they just want to get those thousands and thousands of dollars from transplanting hair from a growing spot to a non-growing spot, but they never address the reason why you lost the hair from, in the first place. That is very, very key, and that's what makes us on cutting edge provider of hair restoration globally, because we want to find out the source and the cause and the reason behind it. Okay, so please go to 248 to call us at 248-356-1111. We also posted in the comment section 10 to 8 where you can schedule a 45-minute consultation. It's cost $75 for 45 minutes. But if you get any of the testing done, we take that $75 to go toward that testing bill. So it's a win-win. Winning for you, winning for us. So please go and schedule that time out. You're worth it. Go to, if you want to email us at info@bw-center.com. That's info@bw-center.com. Or go to www.bw-center.com/MM for Medical Monday so you can get a synopsis about platelet replacement therapy and hair restoration process. Thank you so much for tuning in to Medical Monday. This is Dr. Grace from the Metro Detroit area, managing owner of Bethesda Holistic Center and Everything New, which is a rejuvenation, restoration, anti-aging program at Bethesda Holistic Center. This is Dr. Grace. It is exactly this up here.